Ulcerative colitis is a chronic inflammatory bowel disease that primarily affects the large intestine, also known as the colon. While there is currently no cure, advancements in treatment have greatly improved, signaling a hopeful future for people living with UC. Let's learn more about ulcerative colitis. With ulcerative colitis, the lining of the colon becomes inflamed and develops tiny open sores, or ulcers, that may produce blood, pus, and mucus. This inflammation can lead to persistent diarrhea, abdominal pain and cramping, rectal bleeding, fatigue, and unintended weight loss. According to the National Institute of Diabetes and Digestive and Kidney Diseases, about 600 to 900,000 people in the United States are living with ulcerative colitis. While we don't know what causes UC, it's believed to involve an abnormal immune response triggered by genetic and environmental factors. Family history, diet, stress, and certain medications may increase your risk of developing UC. The types of ulcerative colitis differ based on where it occurs in the digestive tract. Ulcerative proctitis is confined to the area closest to the rectum. Proctosigmoiditis involves both the rectum and sigmoid colon, the lower end of the colon. Left-sided colitis extends from the rectum up through the sigmoid and descending portions of the colon. Pancolitis often affects the entire colon and causes bouts of bloody diarrhea that may be severe, as well as abdominal pain, fatigue, and significant weight loss. Diagnosing ulcerative colitis involves a combination of your medical history, physical examination, and diagnostic tests. A doctor will conduct blood tests to check for inflammation markers and stool tests to rule out infections. Imaging tests, such as CT scans or colonoscopies, may also be performed to examine the colon and take tissue samples for biopsy. If left untreated, ulcerative colitis can lead to serious complications, such as severe bleeding, colon rupture, and increased risk of colon cancer. It's imperative that you keep a close eye on your symptoms and consult your healthcare team when necessary. Once diagnosed, your doctor will lay out a detailed treatment plan. Since there's no known cure for ulcerative colitis, treatment focuses on managing symptoms and achieving remission. Common medications include aminosalicylates. These are often used as a first-line treatment for mild to moderate UC, as they help to reduce inflammation in the lining of the intestine. Corticosteroids are typically used for short-term relief during flare-ups. They are powerful anti-inflammatory drugs used to control moderate to severe symptoms. Immunomodulators work by suppressing the immune system to reduce inflammation. A newer class of medication, called biologics, targets specific proteins involved in the immune response, such as TNF-alpha inhibitors or integrin inhibitors. These are often used when other treatments have failed. In severe cases, or if medications are ineffective, your doctor may recommend surgery. A colectomy is a surgical procedure in which part or all of the colon is removed. The extent of removal depends on the severity and location of inflammation. After a colectomy, especially if the entire colon is removed, your surgeon may create an ileal pouch anal anastomosis, IPAA, to restore bowel function. This is known as a J-pouch surgery. Aside from medical intervention, your lifestyle will play a crucial role in managing your ulcerative colitis. It's important to maintain a balanced diet and avoid foods that may trigger your symptoms of UC. Trigger foods vary from person to person, so it is crucial to be aware of how certain foods affect you. You should also drink plenty of fluids to help prevent dehydration, especially during flare-ups. Mindfulness, yoga, or counseling can help to reduce stress and manage pain or discomfort. Living with ulcerative colitis requires ongoing support from healthcare professionals, family, and friends. It's important to educate yourself and stay aware of current treatments as well as those on the horizon in order to best manage your symptoms. Remember, each person's experience with ulcerative colitis is unique, and finding the right combination of treatments may take time. Don't give up hope. With proper management and support, many people living with UC lead productive and fulfilling lives.